Today we're going to be talking about using the ultrasound machine. The first step in using the ultrasound machine is to turn it on. This particular machine has an obvious sort of flashing button once you plug it in. Sometimes machines will have a switch or a button that you'll have to kind of feel around on the side or the back. It's usually at the base of the machine. You notice here the display. You've got stem channel 1, stem channel 2, ultrasound, and combo. So this machine can be used both in neuromuscular E-stem and ultrasound at the same time in terms of combo. Obviously the setting that we're looking for is ultrasound. If we were using this machine for a neuromuscular E-stem, it has ports on the front. So right here would be where we would plug in the E-stem electrode wires. As it is, the sound head or the transducer head is plugged in here, okay? So first of all, I'm going to do the down arrow right here, and I'm going to select ultrasound. And then I use this forward arrow, actually it points backwards. It's on the right hand side, and I'm gonna select ultrasound. So what I need to first decide to do is decide my frequency. Am I going, basically, is my tissue that I'm going to be treating deep or superficial? If it's superficial, I'm going to go with 1 megahertz. If I want more of a deep heating effect, I'm going to go with 3.3 megahertz, okay? So that's what I'm selecting for today. Next, I'm going to choose the duty cycle. If it's continuous, obviously it's thermal throughout. If you look in your book on page 140, on your Bracciano book, it talks about using settings, whether you're using inflammatory or acute care, proliferative phase, remodeling phase. My client today is more in the inflammatory or acute care phase. So my duty cycle is going to be 10 to 20%, okay? So I go to continuous, and it gives me 10, 20, 50, or continuous. Those are my choices. So I am going to go with a 10% duty cycle, and I'm going to select that, and then I'm going to hit the forward arrow, okay? And next, I'm going to look at the setting of my watts per centimeter squared, okay? Now in the book, it says for non-thermal, inflammatory phase, I'm going with 0.2 watts per centimeter squared, okay? So I'm going to select that. I did down arrow to get my display. I did a forward arrow that it says watts, and I'm going to use the intensity buttons here to go to 0.2, okay? Now also notice that it says warming is on, and basically all that means is the sound head or transducer head is warming during this early phase. It's basically for the patient's comfort, okay? So anytime I'm doing a modality, in your textbook it talks about precautions and contraindications, and that is on page 146 in your book. I would always want to know and talk with my client about what's going on with them medically, their pre-existing conditions, to determine if they have reasons that I should not do this modality. So precautions and ultrasound contraindications are always preeminent before you do a modality on anyone, okay? So I have already used my hand sanitizer to prepare my hands. I'm going to use I've got my machine set using the settings in the book, okay? I'm going to use an alcohol prep to get my transducer head ready. Now, I've already introduced myself to my client, and we've established a rapport and talked about her diagnosis. So what I'm going to be doing today is her diagnosis is more of an inflammation of her extensor carpi radialis brevis. Okay, so I want to use a little bit of transducer gel. Okay, basically this is just a medium, a coupling agent, so that my client never gets too overheated in terms of the tissue, and the sound waves from the ultrasound head can flow through on my client's skin barrier, and this is just a medium for that. So what I'm going to do is get my sound head ready and in place on my client, and then I'm going to press start. Okay. Now the machine automatically gave me a time setting of 7 minutes for this particular client. I could have adjusted using this time up or down for my client, depending on the time that I want to use for this client. So if you look here, I've got my transducer head in place, and I'm going to press start. Okay, and then I'm immediately, you see the green light on the sound head. So that says that I've got contact with my client's skin. If at any time, you should keep contact with the client's skin at all times. And a common mistake when doing therapeutic ultrasound is that individuals use the sound head too quickly. What we usually say is that it's like you're roasting a marshmallow, really quiet, gently, really, it doesn't matter if you go clockwise or counterclockwise, okay? So this is sort of the process. I try not to chase the gel around. I try to get my gel in where I need it, because you don't need to go chasing it. That's a common, so chasing it means you're doing this, okay? So you're losing contact with the client's skin with the transducer head. So the other thing, the rule of thumb is that basically you're going 2 times the diameter of the transducer head at all times. There's different rules of thumb, people have different opinions, but generally we're doing the area that's 2 times the diameter of the head, okay? Say at any reason my client said, wait, can we stop? Or I needed to sneeze or something, okay? So then I'm going to press pause. The green light goes off here on the transducer head. It doesn't really affect my time here, okay? And so basically, so then I can sort of pause it and get the gel back where I want it to be, okay? And then I've got my transducer head in place, and I can resume my ultrasound procedure. So that's really the basics of how we would do therapeutic ultrasound with this particular diagnosis. Okay, so I'm gonna press pause. I'm gonna take the transducer head away from my client's skin, and then I can wipe off the ultrasound gel. And then I had paused it, so now I'm stopping it. Now another thing that I'm going to do before I end up the procedures with this machine is I'm going to go ahead and prepare the transducer head or sound head for the next application with an alcohol prep. Now the other thing that's really important with this procedure, and at the end of each chapter, with the therapeutic modalities that you will have competencies on or using machines with, it will talk to you in the end of each chapter about documentation and what you should include with that. So, you know, the frequency, the duration, the intensity, the duty cycle, all of those things have got to be included in your note, plus subjective and objective information from the client and with this application.